Hey, Gail, you're muted. Sorry.
And I was so eloquent too. Thank you. Good afternoon, everyone. I want to welcome you to this town hall for faculty, students, postdoctoral fellows, staff, all of us who are at the heart of Georgia Tech's research enterprise. My name is Gail Spatt. I am the Director of Research Administration in the Office of the Executive Vice President for Research, and I'm going to be your moderator today. Before we begin, just a couple of housekeeping notes. If you are on VPN right now, you might want to disconnect. The system tends to perform a little better that way. Please do use the Q&A feature to enter all of your questions. We have reserved the majority of our time today to hear from you, so we very much encourage you to go ahead and start asking your questions. And finally, today's event is going to be recorded and will be posted on the Georgia Tech coronavirus site. So moving on, thank you again for being here. Today's forum is our latest effort to keep you informed by sharing information and answering your questions on the status of Tech's research operations in the midst of this public health crisis. Today's panelists are at the center of these conversations about Georgia Tech's response to the impact of the coronavirus on our research enterprise. So we're going to hear a couple of presentations, but again, we will spend the bulk of today answering questions from you, including some that were submitted in advance. So for anything that doesn't get addressed today, though, if we do run out of time, please be sure to go to the Georgia Tech website. That will always have the most up-to-date information. Our first speaker is going to be Rob Buera, who's our Vice President for Research Development and Operations. He'll provide a brief status update for all of us. In addition to his administrative role, Rob is a professor and he has a joint appointment in the Department of Biomedical Engineering and the School of Electrical and Computer Engineering. Go ahead, Rob.
Okay, I will keep my remarks brief. As Gail mentioned, we want most of this time to be a wide open Q&A session. So I want to highlight on only a few things. Two questions we get a lot are we going to change our research density up or down? And when are we going to start allowing more visitors to visit campus? We have two different groups that address this question, one actually weekly, one every other week. And right now there's no change in either. The primary thing is uncertainty. You know, when we see a lot of certainty in both what's happening in Atlanta, what's happening on campus, and then I think we'll probably open these up a bit more. The one positive news we have is with our asymptomatic testing efforts, as well as our campus testing efforts, we know of extremely few cases happening in research labs. The research labs still seem to be one of the most safe places on campus to be. Three other things I want to highlight is we want to highlight that one-on-one and small group meetings should still be conducted online if at all possible. We have heard concerns from grad students about coercion to meet one-on-one in person, so please be accommodating on that. And then I also want to point out on a positive note, we've had teams tackling various issues, and if you go to research.godtech.edu, in the last 2 weeks we have posted guidance. One for researchers conducting field work, and that was a team providing best practices for doing field work. And another on best practices on shared spaces when multiple PIs or teams share a research lab space together. And with that, I want to hand this over to Gregory Abowd to give a brief presentation. And then Chaouki Abdallah will wrap this up around 11:50 with some closing remarks.
Thank you, Rob. As Rob pointed out, we are now going to have Gregory Abowd speak. He's the Regents Professor in the School of Interactive Computing, and he's going to give us a brief overview on his work, which uses Wi-Fi logs to support campus efforts in contact tracing and modeling. Take it over.
Thank you very much. I'm actually going to talk about that work as well as some other work, technology support for contact tracing at Georgia Tech, because I know the community might have some questions or interested in that. So first, I'm going to tell you a little bit about what contact tracing is, and then I'm going to talk about Georgia Tech's use of technology to support proximity alerting and contact tracing. And if I have time, I'll talk a little bit about this last point, assessing the effectiveness of our academic policies and how our data can help us understand that. So to give you a quick primer on contact tracing, the goal here is for individuals, humans, to counsel people who are determined positive with respect to the virus. Those are called cases, and to give them advice and counsel them on how to properly isolate. And the idea is to limit the spread by also alerting those who came in contact with the case so that they can quarantine and prevent any spread. And the idea is to do this quickly. You should know that our health authority, STAMPS, is leading the effort in coordinating both with the surveillance testing on campus and with the Department of Public Health to do our contact tracing. I've listed the leaders of that effort, and there's a team of around 40 volunteers that we should be very thankful to that are handling this in our current crisis. So what is a contact? There are three kinds of contact that matter. One is physical contact, another is close contact, being within 6 feet for 15 minutes or more, and the other is extended contact, it being in an enclosed room for around an hour. So the question is, can we use technologies to help us determine these levels? And I'll tell you, we can't use the technologies that I'm going to show you to do the physical contact category, but we can do it for the other two categories. So the first approach, and that is the Novid app, which was developed at Carnegie Mellon, has been vetted by GTRI, allows us to essentially on mobile devices to be able to do what's called proximity-based, phone-based proximity alerting. So any two phones can sense when they're near each other and can exchange private information so that a phone can keep track of over some period of time, say 14 days, what other phones were nearby and for how long. The messages that are shared between these devices don't reveal any information about the individuals who own the devices or any information about the specific devices. And when an individual who is running this app on their phone tests positive and they alert the app, then very quickly all the people over the past 14 days can be alerted that they had some kind of exposure. The second approach you can use, and this is more of a research-based approach, and this is one that I have been working on, is how can you use something other than installing an app on your phone to get some similar kind of information. So this is using the Wi-Fi authentication logs as a way of tracking where people have been. So your wireless device regularly authenticates to the campus network, and there's a log of that information. And I'm showing you the log here that shows time-stamped information. We have an anonymized log, so we don't know who these people are, but we know different individuals from each other. And the access point you connect to, which indicates the building, maybe the room level, or at least the region on the floor where you have been located. Georgia Tech has over 7,000 of these in its 250 or so buildings, so it's fairly dense. And we can tell using this log information when two individuals are at the same place, which is defined by the same access point, and for how long they've been there. We can use that information. This is a mock prototype that we've been working with people at STAMPS to develop, and I know it may be hard for you to see all the details here, but essentially this shows you the case information, who's the individual, and all the names you might see in here are fictitious, it's all made up. We can show for that case from the Wi-Fi logs over some period of time, where have they been dwelling, so the different colored blocks there show you the timeline of where this individual has been, and we can also indicate the contacts, so people who were close for some period of time, say 30 minutes. So we can highlight these and they're presented visually on the top here. We can also list them textually and order them by any of a variety of things. The top one would be the one that has the most total contact over the period of time, or can be the people who have the most second-degree contacts, meaning they have interacted with the most people beyond just the individual that they just interacted with. So we're working with STAMPS to essentially take this capability and weave it into their work practices for doing the manual contact tracing. You should be aware that there is a very robust surveillance program going on campus, and we have Andres Garcia on the town hall to talk about that. You can go to the website and you can see information about, in summary, how many positive cases of how many tests that have happened. You can calculate a positivity rate from that. You can also calculate a positivity rate on a daily basis, and I've shown these values right here, and it's all available on that particular website. Well, the thing I want to show you is, can we use the Wi-Fi data and the surveillance data to get an idea about whether Georgia Tech is mitigating the risk of spread using this information? So I'm showing you two graphs here. The one on the left is from the fall of 2019. The one on the right is from the fall of 2020, this semester. So both showing data from the first week of classes. The x-axis is showing varying positivity rate from 0, no positive cases, to 10%. 1 out of 10 people tested are positive. So what we've shown here in these two graphs is using the Wi-Fi data from the fall 2019, those two graphs show, and all that there are two there doesn't really matter so much. Look at the top one on the left-hand side. That's showing for any given positivity rate, say 10% over here, all on the far right, how many average contacts have come in contact with someone who tested positive. And what this is showing, that it's over 20,000 people would have come in contact over the course of the first week of classes if we had 10% positivity. That's a lot of people. Look over on the right. Now on the right here, what's changed, the x-axis is the same, the y-axis is very different. Now the extreme on the top here is only 5,000. And we show here, if we had as much as a 10% positivity rate, we would have, and again here we only want to look at the top graph there, we would show 5,000 people having been exposed. But in fact, we're down here at the 2% level, and that's showing us that we're around 2,000 people over the course of a week potentially exposed. And this is an overestimate with this particular technology. So the bottom line is that in the fall, if we'd had this particular virus and we had continued operations as usual, after the first week, we would have had 20,000 potential people who would have to be tested. This semester, we were at week to week, it's the upper bound is 2,000. The bottom line here, our daily surveillance testing capacity currently is about 1,500 samples. So our targeted surveillance capacity can barely handle what we are seeing on campus now. But remember, that 2,000 is an overestimate, and we can pare that down. I think this is positive news that basically says the things we have been doing to prevent people clustering together has really helped us contain this spread in terms of minimizing the number of potential contacts. But we need to keep vigilant so that we can stay open. And that's all I wanted to share. These are the large number of people who have helped in this particular research and operational effort. Thank you.
Thank you so much, Gregory. We are going to move now to some questions, so please go ahead and continue to enter your questions into the Q&A. Rob, this is probably a question for you. If density is unlikely to increase in the near future, any thoughts about whether or when shared user and individual PI labs might return to 24/7 access?
I'm actually discussing this question with Andreas right now because we're making some assumptions. I'm going to defer to Andreas on this as a manager of a large research facility.
Thank you. So we have discussed this for the IBB research community, and the concern of having 24-hour operation is that you may have people coming at hours early in the morning with nobody else around in the lab. And you know, for the type of research that we do, we don't like having people working alone in the labs in case there's an emergency. So we consider this, but decided to keep shifts during, some reasonable normal hours just to make sure that there's more than one person around when people are doing research. So I would encourage from a lab safety perspective that people do not continue working by themselves at odd hours in case there's an emergency.
Thank you, Andres. Andres is the executive director of the Institute for Bioengineering and Bioscience, and certainly he's been heavily involved in these discussions. We really appreciate you being here today. I saw that you responded in the chat to the question about the difference between surveillance testing results and diagnostic testing results, but I thought that was a really good question. Do you want to expand on that at all?
Sure. So surveillance testing is an aggregate measure. So it's really looking at, in this case would be positive cases over the entire population. So it is not designed to tell specific individuals whether they're positive or negative for the infection. That is the role of a diagnostic test, and the conditions and the protocols for which you run a diagnostic test are different and more stringent than for the surveillance testing. So the surveillance testing is, think about it as an aggregate testing of the, the population rather than an individual specific diagnosis.
Thank you. That's very helpful. The next question may also be for you, Andre. Sorry to keep putting you on the spot. Someone asked what the sensitivity/specificity values are for the saliva test we are using.
So the specificity refers to the ability to detect the infection that's specific to what we're probing for. In this case would be the coronavirus specific sequence, and the sensitivity is how we can, how sensitive or how well can the test pick out positive test compared to the other one. So the molecular test that is being run in the surveillance test, so this is a saliva-based test using the molecular RT-PCR. This is really the gold standard in the field, and it has over 95% sensitivity and specificity, if not higher, for those.
Thank you. And one more, this may be you or Robert Chaouki. Will the total number of people tested through surveillance testing be made available rather than simply the number of tests? Comparing the positive cases over the total number of tests will not be the same as number of cases over number of people tested, especially considering that some people have had multiple tests.
So let me try to answer this. This is Chaouki. So yeah, I mean, this is a little bit more difficult, more finer. We do have that, or we're trying to track that, and I don't see a reason why we can't do the total number. We will avoid, or we will not provide data specific to, for example, a dorm or something like that, to say so many in this dorm and so on. So I think that's very possible. I'll take it to see if we can respond or present the number of individuals tested.
Thank you, Chaouki. One other question about testing. What exactly are we testing, both with saliva testing and the diagnostic testing? Is it antibody genome sequencing or something else? Looks like Andres answered that in the chat.
Yeah, so we are testing for viral genes or viral genomic sequences in the saliva on both the surveillance and the diagnostic test.
Thank you. So Robert Chaouki, somebody asks here, what is our exit strategy? For example, when we have less than a certain percentage for more than a certain period of time, then can we start loosening or opening up gradually?
There's multiple things to exit. So I would mention the research continuity group, and we also have a task force. In terms of like research density, we're just looking for stability. When there is a sense of stability on the campus numbers and the Metro Atlanta numbers, we'll probably discuss increasing the density, because at 50% density, we know anecdotally, almost everybody is back in the lab in terms of individuals. Maybe not the hours they want, but we already know there's pretty broad access. And so I would say a sign of stability in both the campus and local population is what we're looking for before we broaden things up.
Let me add something to that. I mean, we also monitor what's happening, not just in the city and the state, but also nationally. As you know, the University of Illinois Urbana-Champaign, tested a lot more than we did. They were doing twice a week or more, and so on. And recently, they had a setback, basically. I mean, I don't want to say they declared victory, but a lot of people assume that they got a handle on it. This is a very tricky virus. I mean, it started with very few infections in China, and it's now millions and millions all over the world. So I think, rather than saying a particular date or a particular number, again, we're looking at a lot of different things, and on the research side, it's much easier, right? Because we can control access, we have a different population and so on and so forth. On the institute, at the institute level, there are a lot of different metrics or signals that we need to have including some that will come from outside Georgia Tech, including from the city, from the state, and so on and so forth. So I wish we can tell you that, okay, when we reach this level, we got it under control, but we won't have it under control until, we're looking in the back mirror, basically. And so we'd rather be safe or more conservative.
Thank you, Chaouki. Another question that we have is, how do our numbers compare to what we're seeing on other Georgia University campuses? And you may be able to answer that, or Rob or Gregory may jump in.
I'm not sure anyone else has gone to the lengths we have to know what their numbers are. That's all I can say. We see the same data you see on UGA's website or Kennesaw State's website.
Yeah. So, yeah, let me try, so without, basically having the data from the others at the level that we have, we don't know. What we do know is that we are doing the most testing, and we're presenting the most data, or we're presenting as much data as possible. Some universities are smaller. Some have made the national news and the system because of some infection rates and so on. But the large ones, namely UGA, State, and Kennesaw, I believe our systems has been a lot more. I guess we're testing a lot more. We're presenting our data a lot, more in a transparent way than most everyone else. Whether they're not able to do it, or whether they know, or they're doing other things that we're not doing. For example, you heard about in Athens, for example, they're doing other types of testing, right? They're testing the wastewater and so on, and trying, So I mean, there are other ways that others are addressing this, but I believe we're not declaring any victory or trying to tell the others how to do it, but we did pull our resources together to do the best we can, and I think nationally we probably are among the elites in terms of the percentage of testing and how we pulled it together. Because remember, Georgia Tech did not have a CLIA lab. Georgia Tech did not have a medical school that we didn't start with that knowledge or background. So we had to create this whole operation from scratch, and most of the difficulties came up not because of the technical or the scientific part, which we had our folks figure out early on. They came because of the regulatory and legal issues and so on. So yeah, we're I guess I'm proud, or we should be very pleased and proud with where we are. However, it's not, we haven't solved the problem. We haven't, done something to say, okay, we're better than you. That's not where we are. In fact, we are being asked to help the others at this stage, to help the state, other USG institutions, but also companies. Companies are coming to us right now. The concern or the limitation is really that our folks have been working 15-hour days in most days right now. These people who are working in the labs, they're really doing amazing work, and they're staying at 2 or 3 in the morning to try to get this thing done and timely, to get the data, to get the test done, and to do it in such a quick or fast turnaround. So I think with that, we're doing better, or we're doing well, but I wouldn't say we're out of the woods, or that we should take a victory lap and say to the others, you're not doing what you should be doing.
Thank you, Chaouki. I don't know if you've been involved in any conversations around vaccinations. There's a question here asking about the Institute's philosophy on vaccinations. This person says there's a sense that vaccination might eventually become more mandated, and there's been some concerns about safety. So I'm not sure completely how to interpret that, but I would ask if there has been any conversation about that.
So maybe I'll pass it to Andres about the vaccination from the scientific point of view. To the best of my knowledge, we haven't had any conversations. I assume this is regarding the CDC informing states that, by November 1, be ready to take vaccines. I'm assuming that's what it is. We haven't had any conversations with that. But in terms of the technical stage of the vaccines, I think, or of actually medicines or therapeutics, I think we have some work on that. I don't know if Andres can expand upon.
mean, I will address the vaccine side. There are phase 3 ongoing clinical trials. Some of those trials are still recruiting volunteers to test to test the safety and the efficacy of these vaccines. There's a couple of leading candidates, and as Chaouki mentioned, the CDC published guidelines telling the states to be prepared from the logistical standpoint on how to distribute the vaccine. I may add that there's a recommendation in terms of the groups that would be receiving the vaccines first. And the first group are the frontline healthcare workers, and the second groups are particularly vulnerable populations, people over 70, people that have chronic conditions. So I don't think that Georgia Tech as a community, based on the broad population that we have, would really fall into those first two groups. So I'm not aware of any discussions about distributing a vaccine when one becomes available.
Thank you all very much. Chaouki, someone is asking in here if we're saying that the Board of Regents has made a decision and the actual numbers on campus don't matter in terms of changing policy. Do you feel like that's accurate?
I'm not sure I understand the question about what the Board of Regents. I mean, the Board of Regents, they oversaw and approved the fall semester modalities. Where we have physical, hybrid, and online. There is no limit or no decision on a certain number on campus. The 50% that we're talking about, this is in the research labs, and this is something that came up from our faculty-led commission that looked initially, we were at 25%, then we went to 50% after we hit some markers and some of the stuff we had. But there is no Board of Regents decision that says you can have so many or you should have so many on campus, as far as I know, which is probably correct.
Thank you very much. Another question, and Andres, you may want to take this or throw it to someone else. What are we seeing in terms of the risks of COVID exposure or spread in the community? And Gregory, you may even be able to weigh in on that one.
Well, I guess it's fair to say that we see the largest number of infections in the student population, and as Rob mentioned, it appears that a lot of them are localized to dormitories and Greek houses. And it makes sense because that's where you have the daily living and contact. I think the classroom precautions, for the most part, are working very well. So I think, again, the key thing for each of us, every one of us, is we are responsible to maintaining the public health guidance, right? We should don't come close to people, continue wearing masks at all time, wash our hands frequently. I mean, following that guidance is what every person needs to do to keep those risks low. One of the things that is becoming clear about the infection is, for many people that are infected, they have long-lasting effects to other systems in addition to the respiratory system. So there's emerging evidence that suggests negative impacts on the cardiovascular system as well as the nervous system. And we really don't know where we are with those conditions. There's also been reports that a COVID infection could trigger diabetes, type 1 diabetes in those recipients. So again, I think the best thing that we can all do is continue practicing safe practices.
Thank you, Andres. Someone asked, and this group doesn't have this expertise, but if Rob or Chaouki, you've heard anything in your meetings, do we have any idea about the availability of flu vaccines and if they'll be offered through stamps during the current situation? Have you heard by anything?
No, but I can tell you, so I have, my sister is a CVS person, and she told me one thing. You know, obviously that they have the availability right now, but today, I mean, it's available. But what they're saying is the pediatricians don't have it. They're not focusing on that. They're focusing on other people. But she suggested, and this is, you know, take it for what it's worth. You know, this is somebody heard it from his sister. So don't who's a pharmacist, that you know, don't take it until September. Do it in September. You know, the first, you know, because it's a 6 months, whatever, efficacy and so on, and that will over, you know, take you to the end of the flu season. She's saying they don't have a problem. CVS does not have a problem right now, but they're giving it to other populations besides the pediatricians for whatever reason, maybe because the kids are not as susceptible right now to corona. But I don't have any other reason to believe or anything about the campus or the availability of vaccine. If you can get it now, I mean, if you want to get it now, go ahead and get it, obviously. I mean, I think the point is, you know, what they're seeing in the Southern Hemisphere is a milder flu season. And the reason is people are isolating. It's not necessarily because of the flu itself, or it's the people are isolating. So it could be that on one hand, it could be milder because we're isolating. On the other hand, the combination of the two could be a lot worse for some people.
Thank you very much. Andres, we have another question where someone is asking, do we know now what percentage of the people who tested positive are actually symptomatic?
So I don't have that data for Georgia Tech, right? Because there's some privacy. We have a barrier between the surveillance testing and then the symptomatic population. But just in the national statistics is around, you know, about 50% of the 50 to 60% of the patients that are confirmed positive are asymptomatic, right? And again, this goes back to the plea to practice safe, you know, safe practices in terms of wearing a mask and avoiding contact. Is that, you know, it's likely that if you are infected and you're positive, you don't feel like you have the symptoms, but you could be transmitting the virus to other people.
Thank you very much. Rob, this one's for you, I think. In the event of a rollback of classes to say online only access, would in-person research continue in any case, or possibly revert to the 25% occupancy number? What would have to happen to suspend in-person?
I'm going to go out on a limb here because it's all going to depend on local circumstances, but we have discussed this question regularly with 2 different faculty groups that meet regularly, and the consensus is right now, if we were to suspend classes, we're not sure we'd make any current change to the density. It's going to depend on circumstances. Research has been remarkably safe. And while we're still doing a deep dive into our cases, if you simply subtract out the number of undergrads from the number of positive cases, what's left over is a small number. So I think we'd be hard pressed to come up with a circumstance where we would rapidly shut down, but I think we would even think twice about scaling our 50% unless the circumstances really warranted it.
Thank you very much. I'll start with you, Rob, on this one since we're already talking, but you can throw this to someone else if you think we need to. Do we have any idea how many contacts have been quarantined? Is there an upper bound for quarantine contacts?
I don't have an answer for that. I do know housing has more capacity, but Chaouki can probably address it.
Yeah, so the capacity for people to isolate, you know, what the institute has is they leased one hotel which has about 140 beds. We have a dorm which has about 60 beds that is empty for that, and we also put something for another hotel in case we need to go above it. Now, mind you, most of these or all of these have been for people who tested positive, not being symptomatic, tested positive, right? Now, if they're sick, of course, you know, they go to a home or to the hospital and so on. So I think we on the hotel itself, the first hotel, there was one time where we had the spike and they were getting close to capacity, 140 beds. They're about, the latest I've seen is that less than 50%, or they went down to about 50% of that hotel. I don't know the latest numbers. So for people who are exposed but not symptomatic, in many cases they're sheltering either in place or they're not you know, we don't track them. So you could be in a fraternity, for example, or in a dorm where you know, the people are testing positive, and the dorm, if it gets above some number, not the dorm, but the fraternity house, for example, goes on lockdown. We've had a couple of those, so we don't know exactly how many overall. No.
Thank you very much. That's very helpful. Chaouki, I'm going to share this next question with you. I'm not sure you can provide an answer for everyone, but you may be able to share some of the philosophies of the upper administration. The question is, for individuals who can and are currently working remotely, will we continue working remote for the foreseeable future for 2020? It seems like this will reduce risk and reduce strain on resources on campus.
I'm sorry, is that a suggestion or a question? What
Well,
is
the
it?
question is, will people who are working remotely continue to work remotely?
Yeah, I think so for the foreseeable future. I mean, we don't have anything, you know, as far as you know, somebody asked the question, when do we come back and so on, we don't have anything on that, you know, specifically to say, yeah, by this date or by, you know, when we hit this and so on. So I think until we receive other instructions, those who are, you know, working with their supervisors and so on, yeah, I mean, you know, I can tell you, you know, in my case, for example, you know, I work remotely. I go to campus when I need to teach, and if I have a meeting that cannot be done outside of campus, and others, you know, who are working remotely and able to do so in consultation with the supervisors and so on, that's what we're doing. We're continuing in that mode until instructed otherwise.
Thank you very much. It looks to me like most of the questions have been answered, either verbally or in the chat, and I will apologize if I have missed any. That would be entirely my fault.
So I got an email from David Q to say that he has data from, you know, he has an app and he has data that shows that about 66% of the GT students who are testing positive are asymptomatic. So that's from David has an app, Count COVID system, which if you don't know about, you know, you should use. You know, there's another email, David. I will respond to you privately on that one, or, you know, we can talk about it. But I think on this one, you know, countcovid.org, if you're not aware of it, you know, it's a way to be.
Thank you, Chaouki. Rob, there is a question in here about building access. So if we were to restrict building access based on participation in surveillance testing, how would that policy work for access to research buildings?
It has not yet been fully discussed, and it would be hard to implement. I would say I think there's a realization when this item is discussed that the implementation would require paying attention to a lot of these issues, and that's really as far as the discussion has gone.
Thank you, that's helpful.
Can I share a little bit, Gail?
Please.
Go ahead, Gregory.
Yeah, just to follow on from that. So I cannot stress enough, and all of us on this call cannot stress enough, the importance of having people who spend any time on campus getting tested regularly. I'm about to teach a class in a few minutes, and the announcement of every single lecture I've given this semester, I just remind students that if you stay on campus and spend any time on campus, get regularly tested. Even if it turns out that things go sour and we have an outbreak that requires us to do something like what we did in March, I don't think the efforts that we've done to this point will have been wasted. This particular pandemic is not going away anytime soon. Right. And I think we can assume that these kinds of things will happen again in our future. And I think we should be very proud of how Georgia Tech has essentially prepared itself to try to respond now and in the future. And it's all about the community engaging, understanding what they're doing, seeing transparent data to see the effect, and complying. So if you spend time on campus, get tested regularly, every week.
Thank you very much, Gregory. It looks like we have addressed all of the questions. Our closing remarks are going to be from Dr. Chaouki Abdallah, who's our Executive Vice President for Research. Do you want to go ahead, Chaouki?
Yeah, thank you. First of all, thank you everyone who's joined me on the call to help answer the questions. And I want to second what Gregory said about getting tested and about the efforts that there are probably more than 200 people, probably closer to 300 people who came together to make this testing in particular reality. But then there are other efforts. I want to highlight some of those. For example, we've had the PPE logistics, to try to get the personal protective equipment to the labs, because some of the labs that did not need them before are now in need of these PPEs. But also we donated a lot of these PPEs to the state and to other entities earlier. We have also the apps, and the COVID Central website. We also have people who are doing modeling, understanding the transmission of the virus and risk assessment, intervention points, etc. We're supporting healthcare workers on the ground. Some of our folks came up with disinfection technologies, protection technologies, etc., etc., etc. So, if interested, look at the research website, and there's a link to. It's called Helping Stories, I think, gatech.edu, about many of the projects, and there are probably I don't know, at last count, a few hundreds that are that people have contributed to or launched. On the other side, or on the other hand, I want you to be proud also of the fact that we didn't stop everything else. So I'm going to give you a couple of numbers. In FY20, research, economic development, and other sponsored activities at Georgia Tech totaled $1.06 billion in grants and new grants, contracts, and awards. Now, last year was the record at $1.05 billion. So even under, the very difficult situation starting in probably February, March timeframe, we ended the year up from last year. Now, these are new contracts, right? Not the expenditures on the old ones, but that speaks also volume to the efforts that our faculty, our researchers, and our colleagues from GTRI have been engaged in. Also, we just had the highest month of award on record in the last 10 years. Total awards about 53 million, which increased about 15 million or 16 million over July 2019. This is ended in July, so not the August numbers yet. And we increased the number of awards from to 285, which is a 75 more than we had in July 2019. So people are still busy, or they're working extra hard despite all the challenges and all the complications of having to work from home, especially for those faculty amongst us who are caretakers or who are taking care of small children. But looking ahead even further, we're looking at a strategic plan that we started for the research. We called it Research Next. So this is a process that we started. We launched just about the time COVID hit, and we're proceeding with that. We have two co-chairs, Wen Masters from GTRI and Tim Lewin from Aerospace Engineering and Strategic Energy Institute. They divided themselves into working groups and focused on 4 areas that emerged during the first phase of analysis, and they're getting ready to complete that first phase. And the 4 areas, or the four divisions that they separated into and tried to study in depth are the world beyond, and this is discussing what's happening beyond our control, outside of Georgia Tech, outside of our control. The world within, which is about our processes and what are the things that internally we can affect. Then research that matters, and this speaks to what areas or what problems will we attempt to solve, and then working with others, which speaks to how do we interact with other universities, with industry, with partners, and so on and so forth. So each group is in the process of finalizing the strategic analysis within their assigned study areas, and later this semester, they will release the phase 1 report. Many of you may have been interviewed or talked to some of them. There will be more opportunities to both listen to this part, try to influence it, but more importantly is what to do about these things, because this is almost the literature review in the research, i.e., we looked at what is available, what is it, where we are right now, and now the question is how we're going to implement some of the or what recommendations we're gonna get to and implement. So with that, I want to say a couple of things that it's been on my mind lately, and that is, Georgia Tech has responded in an amazing ways to this crisis. Many of you have contributed, sweat and treasures and personal sacrifices to try to get us there. And there are few people, or many people, I should say, who are going way above and beyond the call of duty. And those are the people who are, as I mentioned, doing the work for the testing, but also those, the staff members and the faculty and the researchers who are really dealing with a lot these days, above and beyond the normal pressures of the job. So my plea to you is to be kind right now to others. You don't know what others are dealing with. You don't know what people are dealing with. They may have their own personal situations or their own constraints. So I'm almost ashamed about saying it, but I know that in many cases we're a competitive bunch and we try to do the best. We want to be the best in everything. This is one time where we can, basically wait for somebody to catch up or try to ask people how they're doing and so on. And the reason I say that is because I do hear anecdotally about students who feel pressure to do something, or some faculty members who are also under pressure to deliver on something and so on and so forth. So if you're a faculty member and you have students who need accommodations or something else, obviously, it's not just, okay, give everybody a pass, but at the same time, this is an unusual time in their lives. They came to campus expecting one experience. We're telling them, you can't do this, you can't do that. And by the way, we expect you to still operate at the same level or do the things that we expect from a Georgia Tech student. I think we can be, kind, or we should be kind and try to listen to their concerns. And if you need help yourself, please reach out. I went through a period recently myself where, things in my life were extremely difficult on my home front. And, I'm from Lebanon originally, and some of you may have heard about the big explosion that happened. And, I have family, I have other things. And it was a very difficult week for me. And luckily I had people I could talk with and so on. I also have two kids who are Georgia Tech students, two students at Georgia Tech. And also, when the infection started getting very high in their frat house, I was very concerned. I had really tough conversations with them and so on. Luckily, I had people to discuss with and to address and so on. So I'm pleading with you to try to deal with this situation as the crisis it is. It is a crisis, both it's a financial crisis to a lot of people. It's a individual crisis. Some people are dealing with sick folks, and we've lost a couple of people at Georgia Tech to the disease. But also it's a psychological and a social crisis. And for that, let's put our shoulders together and help each other with it. I appreciate everything everyone is doing. Thank you so much, and have a great weekend. And if you're on campus, get tested. Get tested every week. Okay? Thank you.
Thank you so much for that, Chaouki. It was really special to hear that from you. So I want to thank Dr. Abdallah. I want to thank all of the panelists that joined the conversation and those that were here on call in case we needed them to join the conversation. We're very grateful for all of your time. Just a reminder that we will post a recording of this event, and we can all continue to answer questions, you know, whether it's via the recording or if you have new questions, please don't hesitate to reach out. Thank you all very much for being here.
Bye, everyone.